Proud to present my bill today, the Awenen Niin Act, which translates to Who Am I? I am pleased to introduce two people joining me here today, Beth Ponka, who is the Director of Administration of Kinawea Legal Clinic, and Chris Sanders, who is a PhD associate in the Department of Sociology at Lakehead University. Good morning, and thank you for joining me. This act is an act to amend the Photo Card Act and the Vital Statistics Act, respecting access to identification documents. The bill would remove user fees for all services related to birth certificates and Ontario photo cards, and start removing systemic barriers. No one should have to pay for identification. This is a barrier to access to people, and removal of the cost would be minimal. Not having ID may seem like a minor matter, but it's not. It's even hard for us to imagine what it's like not to have identification. It's time for birth certificates and Ontario's basic photo identification cards to be free of cost. During this pandemic, when people and families are dealing with more costs than ever before and less income, cutting the fees for such fundamental rights as birth certificates and photo identification is a simple move this government can make to make life easier for everyone. This will allow people to access the public services they demand and help make life more affordable for Ontarians during this pandemic. The cost for identification in Ontario is an unnecessary burden for all Ontarians. It is especially punitive on those who can least afford it. People like seniors on a fixed income, people with disabilities, people dealing with our justice system, new parents, homeless and underhoused people, LGBTQ people, youth in care, women, and First Nations and Indigenous communities. I'd like at this time to turn it over to my guests to say a few words. Beth, would you like to share your perspective?
Yes, thank you, Judith, and hello, everyone. My name is Beth Ponka. I'm the Director of Administration at Kinawea Legal Clinic. The Legal Clinic is an Indigenous-led nonprofit corporation funded by Legal Aid Ontario to provide legal advice and assistance to people living in poverty who need assistance with income maintenance and tenant eviction prevention. The Awenen Niin ID Services Program was established by Kinawea Legal Clinic in 2012 in response to the gaps and barriers that we were noticing were being experienced by vulnerable people who need identification to access basic programs and services. The Awenen Niin ID Services Program was given its name by Anishinaabe elders, the late Louis Brazard and his wife Helen Young Brazard. Awenen Niin is the Ojibwe term meaning who am I? Without ID and birth certificates in particular, it can be difficult or impossible to access basic services such as social assistance, obtain housing, get a social insurance number, open a bank account, or even pick up mail at the post office. You even need a birth certificate to get food from most food banks. And even yesterday, I was reading a story about how people may not be able to get access to the COVID vaccine without ID. Cost is the biggest factor preventing access to ID. However, there are other numerous significant barriers, including onerous information requirements, literacy, language, cultural, and colonial barriers. We are incredibly honored to be working with Judith Monteith Farrell and her staff on this private member's bill, and look forward to ID being accessible for everyone in our society, including the most vulnerable. Thank you, miigwech.
Thank you, Beth. Thanks for those comments. And I'd like to turn it over to Chris now. Chris?
Thank you, Judith, and good morning, everyone. I'm a professor at Lakehead University, and I've been, along with my research partner, Kristen Burnett, we have been working with Kinawea Clinic and Beth in particular to kind of study this issue of personal identification in Northern Ontario. And we have particularly been focusing on on birth certificates because they are this, as Judith and Beth both pointed out, they're this foundational piece of personal identification. It gets you access to everything else: health cards, driver's licenses, a SIN, bank accounts. And this has implications for access to healthcare and education and employment opportunities. And one of the key findings of our research so far has been that cost is this #1 barrier to accessing birth certificates. And a birth certificate, they can range from $25 to $45, depending on the type of birth certificate and whether it's a replacement. And that amount of money, for a lot of people, it may not seem like a lot of money, but for people who are living at or near the poverty line, like every penny counts, and that fee can be prohibitive, which is why we strongly support this private members bill that Judith is sponsoring, because it addresses the most significant barrier of cost, and we're also grateful to be working with Judith and her team on this.
Thank you, Chris. I think at this time we are going to see if there's any questions from our journalists.
Thank you, Judith, and thank you to journalists for being here this morning. Just a reminder to use the hand up function to ask a question, and we'll wait a moment for you to do that. It looks like we have a question from Net News Ledger, and just one moment. Go ahead, please.
Was you, Judith?
Good morning.
This is great news. This is really great news. When you talk about the ID, I know that the birth certificate is a part of that. One of the big things that some of the youth had expressed last year was SIN numbers, social insurance numbers, with that because they had a copy of their birth certificate from Kinawea with a Kinawea legal stamp, it was not accepted. Would that be a part of this as well? Like if they're stamped with like Kinawea Legal Clinic, who's partnering up with you with this bill?
I think what we would do is hopefully we wouldn't even need sometimes Kinawea Legal Clinic's services in this. People could access easily their birth certificate and have an original that they could use for all access to other programs and things like their social insurance number. It's become increasingly bureaucratic with layers of people having to be involved in something that should be so fundamental. And so that's our hope, that this bill will open the doors, that people have easy access to their identification.
Oh my God, that's great. Thank you.
Any follow-up question on that News Ledger? Okay, if there are any other questions from journalists, please raise your hand. I'll just wait a moment. There are no further questions. I will hand it back to you, Judith.
Thank you. And thank you everyone for your interest in this really exciting initiative, I believe, and I'm excited to be presenting it for first reading today at Queen's Park. If you don't have access to basic identifications, life is so much harder, and you cannot access provincial and federal programs. And in these times, access to programming is so very important. And so I'm encouraged that we could convince this government that this is a good initiative. In Northern Ontario, we have even more barriers, where many communities struggle to access any public services. We especially need to remove all barriers that unfairly block people who need those programs most. Simply because they can't afford identification should be no reason that, for them not to be able to get the services they need. And we need to remove this and ensure that people can afford to get their identification. So I'm looking forward to presenting it today, and thank you everyone for participating.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.